For more on all this, let's bring in Dr. Devi. She joins us now. She is the director of Metropolis Pain Medicine and author of Coronavirus Made Simple. Make this simple for us, Dr. Devi. We're all trying to understand the changing guidelines that we are hearing from the CDC, the White House, and others. You look back at the Surgeon General's warning on wearing face masks. This is a tweet from February. Seriously, people, he said, stop buying masks. They are not effective in preventing general public from catching coronavirus. But if healthcare providers can't get them to care for sick patients, it puts them and their communities at risk. And now we see those guidelines changing to actually it's a good idea to wear face masks. So how do we dig through what we're being told here, Dr. Devi?
Yeah, I think there's a big difference between saying the masks are not necessary versus saying the masks can help, but healthcare providers need them instead. That's very troubling. So I'll help people kind of visualize what the debate is about. The debate is really about whether this virus travels as a respiratory droplet or whether it travels and spreads as an aerosol. So, as a simile, so I have a toddler who loves to blow bubbles. And when I blow them with this wand, they form a little bubble and they can only travel so far. That's basically how a respiratory droplet works, that it sort of travels for maybe up to 6 feet, but then it'll pop and then it'll land on the ground or on a surface, but it won't travel very far. Now, an aerosol is more like perfume or smoke, where it can linger in a room for a while, or you can smell it from even across the room. So if it's a respiratory droplet, which is what almost all of the data suggests, then if you wear a mask or if you don't wear a mask, you might be okay as long as you stay about 6 to 10 feet away from someone else. Now, I think to be safe, why not wear either a mask or a scarf or something to protect yourself if you're going to the grocery store, you're going someplace where there are other people involved. If you're sick, you'll protect others, and otherwise maybe, it does no harm really. But if it's an aerosol, the problem is that these masks and scarves will not be enough to help you. The N95 respirator mask is the thing that really protects people. But so far from what we know, the aerosol really is only created in the hospital setting. So if someone is having a breathing tube put down their throat, if they're having procedure to take a look at their lungs, those things create aerosols. But for people at home, they generally wouldn't be exposed to an aerosol.
So as far as picking up a bandana or a scarf, if you have to jump into an Uber or go to the grocery store, would you recommend that?
Yes, I do. I mean, I'll tell you what I tell my parents. So my parents are watching my daughter. They've been together for 3 weeks. They're upstate. They're all healthy. I tell them to just stay indoors because that's the best way to stay healthy. But on the other hand, if somebody has to go outside, if they have to leave, I think they should wear a mask or wear something to wrap around their face to protect themselves.
Mm-hmm. And as far as treatment is concerned, it seems like we are making progress there. And when it comes to this plasma treatment, what can you tell us about this being a game changer as far as this virus is concerned?
Well, the first studies here are just coming out, the results, and it seems that this convalescent plasma, which is the idea of taking antibodies from people who have recovered, so people who have figured out how to fight the virus through their antibodies, taking those and putting them into people who are sick and having trouble getting past the virus, those antibodies may neutralize the virus and help them to recover. So in this first study, it was of 5 people. They all seemed to do better after getting the antibodies, but there's always a debate because they all got it. It's hard to know, did they get better because of the antibody or did they get better because their own bodies figured out how to fight the virus? None of them seem to do worse, so I look at it as very promising, and hopefully we can increase the numbers and get more information on that.
Dr. Devi, it seems like we hear a lot about the shortage in those physical supplies, like the hospital gowns and the masks. But there's also been reports of a shortage in the actual medicines that are needed to treat people who are in the hospital, especially with the respiratory problems, treatment for the respiratory side of things, and also sedatives that are used on those that have to go on those ventilators. So what are we hearing on that, and are we making any progress in building up our supply of those medicines?
Well, this is a concern. I mean, these sedatives are used to put breathing tubes into people's throats. And generally speaking, you want to be sedated for that process. Like if you're ever having a surgery, you really don't want to experience both the breathing tube and all of these different invasive lines and procedures being done to you. Now, the debate is, if we're running low on those, will we have enough for when people get intubated, when they have the breathing tube put down? And will we have enough when people are on these ventilators to keep them sedated? Now, they don't necessarily need it when they're on the ventilators. It depends. If they're confused, they might, because we don't want them to rip out the breathing tube. If they're awake and alert and cooperative, they might not need it. But at the same time, who really wants to be awake if you can't see any visitors and you can't really do much? Now, I'll say, I personally, when I was 16, I was very ill. I had heart and lung failure for a different reason. And I had a breathing tube put down in an emergency setting by the Code Blue team, just to kind of help me survive to get through that. And I will say, it was very it was traumatic. It was the worst thing that happened to me, the whole experience, and to my family. But on the other hand, I got through it. I survived. Those doctors and nurses saved me, and I became a doctor. And that's how I visualize this crisis, that, it's going to be very difficult. But when we come through the other side, hopefully we can all pay it forward.
Dr. Devi, finally, where's your level of optimism this morning? You're always a very optimistic person, but as you have been watching this pandemic, and we have been catching up with each other regularly throughout it, where do you stand on where we are in all of this morning?
Well, every day, we hear troubling reports. More people are dying over time. So it's hard to be optimistic under those circumstances. On the other hand, I look at everything else that's going on. When we look at those curves, they're showing us sort of the expected hospitalizations, the expected deaths, and then how we can flatten the curve. But a lot of them are missing the hospital capacity, which is basically a line showing how many lives we can save. And that's changing every day because, look at the production of the ventilators, all these companies coming to help, the production of the PPE, everybody jumping in, staffing, all these people volunteering to also help. So, the hospital capacity is also increasing. So the number of lives that we could potentially save is increasing every day.
All really good information, Dr. Devi. Appreciate your time this morning. Thank you. We'll check back soon.